to this very special GLI Live Extra for World Hepatitis Day. I am very excited that Michael Ninburg, Executive Director of the Hepatitis Education Project, has agreed to be our guest today, because who knows more and who knows better about this topic. Fun fact. So sometimes we get questions about who do I look up to, which is a question I'm very touched by. And so here is your answer. If you have ever wondered who I learned from, who I look up to, who is one of my favorite people in patient advocacy, well, here is your answer today. Michael Ninburg. Welcome, Michael.
You are too kind, Donna. Well, the respect is very mutual, and it is a relatively small community, and it's amazing what a small group of dedicated men and women and youth can do when we have some passion and some goals. So I do appreciate that, and the work that you're doing at GLI is remarkable.
Well, thank you. I learned from the best. So we wanted to make sure that we were recognizing World Hepatitis Day, July 28th. So hopefully you're viewing it today, July 28th, and but know that this is an important topic for every day. We just didn't want to miss the opportunity to draw attention to it. So we know that millions of people around the world have viral hepatitis. Well, at least you and I know. Not enough people know that, and not enough people who actually have viral hepatitis even know that they do. And so for World Hepatitis Day this year, what is the theme? Tell us what you want people to know most.
Thank you, Donna. So every year for World Hepatitis Day, the World Health Organization comes up with a theme, and sometimes it's the same thing a few years running. A new theme this year is Hep Can't Wait. And really, part of the issue around viral hepatitis in the US and globally, you mentioned it, so many people do not know that they are living with hepatitis B or hepatitis C. And the opportunity to intervene to get people tested and treated and cured for hepatitis C is there. We have treatment now that is almost universally effective in curing people for hepatitis C. We have very effective treatment for hepatitis B for those who need it to keep that viral load suppressed and prevent disease progression. But people can't avail themselves of these amazing medicines if they don't know they're diagnosed. And what happens is with hepatitis B and hepatitis C, they are relatively slowly progressing diseases. So it can be decades or longer before some people present with symptoms. And oftentimes it's too late, because when they do present with symptoms, sometimes it's because they are already living with advanced cirrhosis or liver cancer. And so the idea of Hep Can't Wait is, we have this window of opportunity. People are dying every day. The number of people who die every year globally for hepatitis B and C has surpassed that of HIV and malaria. And it's kind of right there with tuberculosis. And unfortunately, with the big three, HIV, malaria, and tuberculosis, we've seen that kind of morbidity and mortality decrease through these amazing interventions with a global effort to address those three. We haven't seen that with viral hepatitis, and that's a problem. And so one of the nice things about the Hep Can't Wait theme is that there are a number of things that people are doing with the theme. Wonderful posters, with the picture of a person. Stephen can't wait. Youth can't wait. Pregnant mothers can't wait. So it's really speaking to the urgency of addressing this global crisis?
I think that that's so important. We have spoken out throughout this pandemic, throughout the past 16 months, about the trauma on patients when their transplants were just canceled, their liver cancer screenings were just canceled, and so many of the really effective community programs were all just canceled, pulled away from people. And the need to put those back online and being able to walk and chew gum to treat both COVID patients and non-COVID patients whose diseases, as you said, continue to progress. That not as if we put our liver cancer on pause and just say, liver, just stop, virus, stop replicating, because COVID is the only virus that's important. It doesn't work that way. And so we needed to find a way to to put all of these programs in place. And you have one of the leading programs in the country and in the world. So can you tell us more about what you do?
Sure. The Hepatitis Education Project came together in 1993 as a support group, basically. It was started by, first and foremost, patients and a research hepatologist and his research coordinator at the University of Washington, when very little was known about hepatitis C. The natural history was unclear. Hepatitis C had been cloned and named only a few years earlier in 1989. But there was a couple of things. There was this, I think, fear on the part of patients who were diagnosed then. I was diagnosed around that time as well. And there wasn't a lot of answers when patients asked their clinicians, what does it mean? What does that mean? I have hepatitis C. Richard Wilson, the doc at UW, was one of the better practitioners in that he would say, we don't know what it means right now. People were getting everything from, don't worry about it. That's what I was told. Or, it was clear that some people with hepatitis C had advanced disease, were dying of liver cancer. And, some people were told in the early 90s, you might want to get your affairs in order. You might need a new liver in 5 years. And it was just a very scary time because there was no consensus, and what your prognosis was really depended on who your clinician was. And to Richard's credit and the credit of the patients who started HEP, they realized that we didn't know what we didn't know, and this was probably a much bigger problem than anyone really appreciated, and it sure turned out to be, unfortunately. So out of that support group, we slowly kind of added some services like training support group leaders. I came on about 10 years after HEP formed, and then started to do more direct services. We started doing education in prisons and jails, where hepatitis C prevalence is very high, somewhere around 20 to 30%, depending on where you are in the country. We started doing testing for hepatitis C in the early days when it was a dried blood spot and it was just an antibody, and we had to send it to a lab in Illinois, and the results would come back a month later, and half the time we lost the people that we had tested because we work, primarily with underserved and marginalized populations. And we've got, a great team now. We have about 20 staff, most based here in Seattle. We do so much more now. Really kind of broadly kind of access to healthcare, drug user health. A couple of years ago, we started a low barrier clinic for medication for opioid use disorder, and that's been very well received because a lot of the folks that we work with who are living homeless, who use drugs, who are in and out of prisons and jails, their access to healthcare, as we all know, is very poor, and a lot of times that's because their interaction with traditional healthcare systems is filled with trauma and stigmatization, and they don't get treated well in the ER, or they're told that they're drug seeking. And so, at HEP, we've been in the community for more than 20 years, and we have we've established a reputation and an ethos of meeting people where they are and treating everyone with radical love, and that's that's what we do. We also do a lot of policy and advocacy. We do that at the local, state, and federal level. Of course, we do it in the global health space as well, with the World Hepatitis Alliance. But that's a big part of what we do. And I'll also add that we do kind of care coordination, linkage to care. That's a huge piece for people with hepatitis who get tested oftentimes. And again, it's folks who aren't connected to traditional healthcare systems. They get tested, they might get diagnosed, and then there's no kind of connection to a treating provider.
So advent of, I'm sure that sort of close the gap, so that you don't lose as many people. There are programs in Washington, D.C. where people are flagged in the emergency room, so that they're not, even if if hepatitis isn't what they were coming to the ER for, but they can be treated there and linked to care. What can people do in their community? So on July 29th, what should people go to, their hospital or their, community center or their local, city council, and ask for a volunteer or try to put into motion?
That's a good question. I mean, I think one of the things that I've been telling my friends and family to do since last year is when you go to see your doctor for your annual exam, ask them if they are testing everyone for hepatitis C, because now, as of last year, both CDC and the U.S. Preventive Services Task Force have a recommendation that all adults get a one-time antibody test for hepatitis C. And that was huge. That was something that we've been advocating for a long time. We aren't going to get to elimination of hepatitis C without something like universal screening. And when those recommendations came out, that I won't say it was a game changer because it hasn't quite been implemented yet. And of course, those recommendations came out, just a few months into the COVID pandemic. But clinicians are starting to do that, and we've heard mixed stories. Some clinicians are doing it, and they do that one-time test. Some healthcare systems have implemented that test recommendation into their electronic medical record. Most have not. So I think that's a very simple thing. Next time you go see your clinician, doesn't matter how old you are. Well, 18 years of age and older is the recommendation. Can I get tested for hepatitis C? Or are you testing your patients for hepatitis C? Do you know that there's a new recommendation from CDC that every adult should get a one-time test? So I think that's one thing. I think you do such a great job in kind of advocating for liver health generally. I think that's something that we can do just as kind of evangelists. And I would say it's not just hepatitis, viral hepatitis. I think fatty liver disease, NASH. We know that is the next tsunami of liver disease, not just in this country but globally. And so I think there are some opportunities to address liver health broadly. And for hepatitis B, I think it's a little bit different. There is a push now to get universal screening for hepatitis B as well. CDC is working on that, and so that may come out sometime this year, perhaps. And when those recommendations are out, it does make the advocacy much easier than remembering, test, people from countries with a certain level of endemicity, or pregnant women, of course, have always been, screened for hepatitis B, or, in the last 20, 30 years. So those are a few things.
I think that's fantastic. And yes, I hear about deputized liver health advocate and ask you to go into your doctor's office, or, in my case, also the hospital boardroom, making sure those protocols in place. Because I think it's an important part of destigmatizing
Absolutely.
hepatitis and liver disease as a whole. Everyone has a liver, so everyone is potentially at risk for liver disease. There's no sort of like type or profile of person who has liver disease. It can affect, everyone. And so I think if every adult goes in and asks for their hepatitis C test, that's a wonderful action that everyone can take to move us towards a goal of hepatitis C elimination and improved liver health. So.
Absolutely, and even above and beyond the clinic, telling your friends and family to do that.
Right. Christina's going to have me do a TikTok video where she's plotting it behind the scenes now.
I look forward to seeing that.
Fantastic. Michael, thank you so much for your time today. Thank you for all of your hard work and just the brilliance and elegance that you bring to it.
Oh, Donna, I am very, very grateful to be in this space and working with wonderful people like you. What you've done in the past few years with the Global Liver Institute is truly remarkable, and you are making a difference in people's lives. And again, I feel very, very fortunate that I get to do this work and get to do it with wonderful people and advocates like yourself.
Thank you. And thank you to everybody watching and listening. You have our information there, globalliver.org. You can find us on and these other videos on YouTube and Facebook, and apparently on Instagram and everywhere that my social media folks need us to be. But we want everybody to hear this message and to have the information they need to make themselves and their communities as healthy as possible. So until next time.
Happy World Hepatitis Day.